Hi, I'm Elissa Bantug here in the Johns Hopkins Breast Cancer Program. Today we're joined by Dr. Julie Everett, who's a physical therapist with an expertise in pelvic floor and sexual dysfunction. Hi, Dr. Everett. Thank you so much for joining us.
Hi, Elissa. How are you?
Good. It's great to have you.
Thank you.
To start off, can you tell me a little bit about some of the sexual concerns you hear from patients either during treatment or after they're done with treatment?
Yes. When it comes to sexual health, a lot of times patients will experience pain, vaginal dryness, or even decrease the libido after breast cancer treatments or any other kind of interventions.
What percentage of patients would you say experience some type of sexual dysfunction after breast cancer?
So in the normal population, it's pretty prevalent already. It's 43% in the normal population. During treatment, it's up to about 65%, and then post-treatment, back down to about 45%. So it's very, very common for patients to experience some sort of discomfort or sexual dysfunction.
So when we talk about sexual dysfunction, is it something that patients have to learn to live with, or are there things that can be done to kind of address some of these things?
No, there's absolutely something that can be done. There's a variety of different treatments that we as physical therapists can complete. We can do a variety of different manual treatments, biofeedback. We can work on muscle relaxation. We can work on positions and techniques to help you kind of get comfortable again with being sexually active.
Mm-hmm. So you mentioned vaginal dryness. What would you recommend for something like that?
So for vaginal dryness, there's two things that I would recommend. One would be any water-based lube out there. There's some great ones that you can buy in the store or offline if you don't feel comfortable buying them in a store. And another product that I really enjoy using for my patients is coconut oil. It's all natural, it's very comfortable, and you can also use it for scar mobilizations and things like that.
And things like pain, what would you recommend for something if there's pain during intercourse?
Pain during intercourse. Well, that's a little bit of a deeper question because we have to figure out why the pain is there in the first place. The first thing that I would definitely recommend is starting off with a little bit more of a partner massage so that you can really work on relaxing the muscles, kind of getting your body ready for that sexual intercourse, because a lot of times what will happen is people will start to tense up because they may anticipate some of that discomfort. So being able to get yourself down and relaxed into a comfortable position is where I would generally start. Foreplay is a great thing. Try to get yourself as lubricated and involved into the act before you actually go forward. And if it continues to be a problem, I would recommend either going to your gynecologist, asking them and seeing if there's anything that they can do, maybe a topical lidocaine or some sort of medication, and then following up with a physical therapist as well.
You've mentioned some of the physical issues, but what about some of the more psychosocial or psychological issues such as body image? Are those concerns, and what do you recommend that patients do about that?
So this is a great question, Elissa, because a lot of times as you're starting to go through that survival phase of treatment, you become a medical body. Your body is about getting the cancer out and fixing that. And what we see is as we start to progress towards the thriving and after treatment, we need to get you back to your physical body and your sexual body. And this can sometimes be difficult, especially if a part of you has now been taken away. It's really important to also find some new areas that may be more sensitive, since the areas that were so sensitive may no longer be. So I would really recommend a lot more self-exploration. You know, a lot of times my patients say that the scars tend to be a little bit more sensitive. So explore some new areas and see where those sensitive areas now are.
What can partners do during this time to be supportive?
Well, first and foremost, I absolutely love when my patients have their partners come in with them. Sure. It is so wonderful to see. It's really supportive, and I know it means a lot to the patient too. They may not actually say anything about it, but it really does help them a lot. And I would recommend that communication be really key. Just realize that your partner has gone through a life-changing event, and just being able to understand that. Don't be afraid of them. Don't pull yourself away from them. This is when they really need you to be there to help support them. So I would definitely recommend that the partners start with massaging as well. Just because you're sexually limited with maybe some pain or some discomfort and fatigue does not mean that intimacy needs to be affected. So just being able to touch, just being able to caress, just being able to hug is really important. So I would recommend the partner still be a big part and really help out in that area.
Sounds like it's really important. And you mentioned a lot about some of the physical issues and some of the psychological issues, but if I'm a patient experiencing some of these things and trying to figure out, are these issues psychological or are they physical, what would be the good place to start?
I would definitely recommend starting out with your gynecologist for any of the GYN issues. I would also highly, highly recommend that you talk to any medical professional that you may come in contact with as you're going back in for checkups. Talk to the nurse navigator, the social workers, the doctors, and say, hey, I'm feeling this. Is this typical? Is this normal? Because they may have some recommendations as well. If you go to your gynecologist, you can start talking about anything that you may need medicational-wise if there's any issues. The GYN would also be able to kind of triage any of those issues that you may need to go more towards a mental health professional. And in that area, you have a wide variety of help there. You can go to social workers, you can go to psychologists. There's even sexologists out there that can help you with positions, being able to kind of reconnect intimacy with your partner as well. So I would recommend, definitely going out there and asking who you can go see.
So it sounds like it's really important for patients to be their own advocates and kind of be able to talk to their providers, even if their provider doesn't bring it up with them.
Oh, absolutely. Just as it might be uncomfortable for a patient to mention something, sometimes doctors and medical professionals, we may feel a little bit embarrassed bringing up the topic as well. So I think together, if we work together on bringing this topic more to light and having these open, frank conversations, I think we can really move forward in being able to help people out with their sexual dysfunction.
Wow, Dr. Everett, this has been so helpful. I know I've learned a lot, so thank you so much.
Thank you so much.
Thank you for joining us.